As a kidney transplant surgeon who has done more than 3,000 renal transplants, there are a few questions which most patients and donors ask me. So I will try to help you clear your doubts on these matters. A kidney transplant patient often asks, will his kidney work? So statistically, at 1 year after a kidney transplant, most kidneys, upward of 95% cases, are working. After that, every year, 1 to 2% of kidneys fail because of infection or rejection. However, if we go by mere statistics, at 10 years, again, upward of 80% of kidneys are working. However, there is no timeline, but if I have to say an average, kidney would work for 12 to 15 years. Post a transplant, virtually all kidneys produce urine. However, because the immunosuppressant drugs which are given are less than kidney friendly, it requires dose titration and there may be other challenges. So a patient is kept in hospital for a week. Once his kidney function is stabilized, he is discharged. After 3 months of surgery, a recipient can do everything including sports. As far as donors are concerned, a donor needs to be between the ages of 18 and maybe up to 65, should be in good health. The donor needs to be related to the patient either as a first degree relative, which means a brother, sister, mother, father, son, daughter, or a second degree relative like a nephew or a niece or an uncle or an aunt. Taking one kidney from a donor, the common concern is what will happen to the donor's health going forward. So the most important thing to maintain good health is do not gain weight. So if the donor ensures that he or she is not gaining weight, then they would continue to have a normal life as they would have with 2 kidneys. However, before we select a donor for surgery, there is a rigorous screening. So if there are certain conditions which would adversely impact the donor going forward, we would not take such donors to donate a kidney. So there is nothing to worry. You can donate happily, go back to strenuous working and games within a very short period of time. The hospital stay is barely 3 days and the surgery is keyhole laparoscopic. You can go back to strenuous physical activity like sports in 3 to 4 weeks after surgery. Thank you.